5 on your health now, continuing the conversation after a decision from Health Secretary RFK Jr. to fire 17 experts who regularly advise the CDC on vaccines, including immunizations for children. I don't think I need to introduce you to this wonderful young man here. This is the man known for decades as America's doctor. And to this day, we call you that because you're so beloved. And this is Dr. Timothy Johnson. Dr. Tim is how we refer to you here. You heard Secretary Kennedy say that he plans to pick new experts who are neither pro-vaccine or anti-vaccine. Is that even possible?
No. You should not be on that committee unless overall you are pro-vaccines. Pro-vaccine means you understand that vaccines are a huge public health development. Now, you can certainly question schedules, doses, various issues about how to give them, but you have to be pro-vaccine or you're simply ignorant about what's happened in our society.
About what's happened. So as you know, Secretary Kennedy is encouraging parents to do their own, quote, and I'm quoting, research on vaccines. So where do you suggest that they start?
When I heard that, I laughed out loud because, in fact, unless you're already a trained medical scientist, it's impossible to go to original studies, to understand them, to evaluate them. When I became medical editor for ABC News and medical editor for the Harvard Medical School Health Editor, even though I had an MD degree, I realized I was incompetent. So I went to the Harvard School of Public Health.
What do you mean by incompetent, Dr.
To
Tim?
evaluate these very complicated studies. So I went and got a master's degree in public health so I could do so. Parents can't do that. Unless they're medical scientists, they have to rely on other experts, starting most importantly and usually with their own pediatrician.
So start with your pediatrician. Knowledge is power here, but it's where you get that knowledge that matters.
You've got to make sure it's a reliable source. Pediatricians generally are very reliable. Sources on the internet like the Mayo Clinic Health Letter or the Harvard or the Cleveland Clinic, know your sources. Don't go out there and just accept anything you see or read.
Okay. Can you take some questions?
Of course.
Quick ones, okay. Here's a question from Dawn Marie. We're about to be grandparents with measles on the rise. Should we get a booster even if we were immunized as children? She adds that she and her spouse were born in the mid to late 60s.
You know, that's a common question and not totally easy to answer in a very simple way. In general, we say that people who've gotten the 2 vaccinations are going to be immune for life. But if you're worried about particular circumstances, your own medical conditions, consult with your doctor and find out.
Right.
Most people will not need them. Occasionally there are people who will, but that's very rare.
Very rare. Okay, this one is from Joanna. She has a newborn. I really should have brought my glasses over here. Okay, here we go. Can I schedule the shots so my son doesn't get so many at once?
Very common question, and pediatricians deal with this all the time. And many pediatricians will delay the schedule a little bit. But in general, we like to get them according to the approved schedule.
Right.
When kids are born, they're not immune with their own systems until they're at least 6 months old. So we like the regular schedule, but many pediatricians will allow some modest variation.
Okay, this one is from Lisa T. She watched you yesterday on Channel 5 and she wants to know, quote, how do you stay so sharp? And I want to know, how do you look so young and so good, Dr. Tim?
Oh my. My answer is pick the right parents.
Pick the right parents. You certainly did. And I asked you if you would share your age, and you said absolutely.
89.
89!
Another year 90. That's the one that blows my mind.
You're amazing. And you are America's doctor, but for us here at Channel 5, you are always in our hearts.
Thank you, Maria.
All
Thank
right.
you.
Great to see you, Dr. Tim.